Good afternoon, everyone. Welcome to the Gender Affirming Care webinar. I am Christopher, the Outreach Coordinator for Seeds of Healing. Seeds of Healing is a HIV awareness and advocacy organization whose mission is to deconstruct myths that perpetuate HIV stigma. Our work seeks to eliminate disparities for Black women living with HIV. This webinar is being recorded and will be shared to our SoTime platform and posted on our YouTube channel for you to share with others or come back and watch for yourself. Attendees are able to drop questions in the chat box and will be shared at the end of the webinar, but these will not be anonymous. If you wish to be anonymous, please use the Q&A feature at the bottom of your screen. Feel welcome to ask questions and write comments throughout the program. Additionally, at the end of the webinar, we will be sharing a short survey. We would appreciate it if you took a couple minutes to complete. The survey is already in the chat, guys, so if you see it, do your thing after. So let me introduce the speakers. So first we have Jack Foley, MD. Jack is originally from Midwest, where friendly faces are abound. Jack then moved to the Arizona desert for graduate school, where he received his medical degree. Since moving to North Carolina coast, he quickly learned of the welcoming nature here, warm weather and warm hearts. Dr. Foley seeks to meet patients where they are currently and enjoy using shared decision making. That's beautiful. Next, we have Andrea Singleton, DO. Andrea Singleton is a rising third-year family medicine resident from Greensboro, NC. She attended South Carolina State University for college and then attended NYIT College of Osteopathic Medicine at Arkansas State. Her interests include women's health and addiction medication. Again, my name is Christopher. I'll be helping moderate the panel today, and I'm turning over to Jack.
Okay, thanks, Christopher. I'm going to go ahead and share my screen. That will pull up the slides that goes along with this presentation. I'll go ahead and turn the first part over to Dr. Singleton, who will talk first, and then I'll talk kind of for the second half. We'll try to keep an eye on the chat box if questions come in. If they're sort of brief questions that we can answer there on the spot, we'll go ahead and do that. Otherwise, we may just wait till the end to do that. So, all right, I'm going to share the screen. Go ahead and start here.
All right. Good evening, everyone. I'm using Jack's audio, so I hope that you can hear me okay. Again, my name is Dr. Andrea Singleton. I am from Greensboro and happy to be here in Wilmington, North Carolina, the lovely beach. So today our presentation is on Gender Affirming Care 101. We put together this presentation as providers to really go over what gender affirming care really means. We will start off our presentation with defining some terms related to gender affirming care and related to gender expression, identity, as well as sexual orientation, to really provide some clarification on these terms as they are referenced throughout this presentation. Okay, so overall, defining gender. What is gender? So gender is non-binary and it is fluid. Gender identity and gender expression can vary across one's lifespan. Development is also something that is important when you think of context of gender overall. There is a connection between gender, sexual health, but gender and sexuality are different. Genitals and genetics do not equal gender. And it's important to note, as individuals grow and develop, they may choose to identify with a different gender throughout their lifespan. How we define and understand gender is impacted by social constructions and what is deemed quote unquote societal norms. Overall, development is still important when considering gender, but there should be a distinction made across development. Children are not adolescents and adolescents are not adults. And it's easy to begin mapping gender expression from an adult perspective, but it's also important to consider it from a perspective of children and adolescents as they are distinct. As far as other terminology to define gender, we're going to the aspects of cisgender and transgender. So cisgender meaning a non-transgender, gender diverse person who identifies as their presumed assigned gender, which directly correlates to their physical sex. They may or may not conform to gender-based expectations of society or those societal norms. And what is transgender? Transgender is an umbrella term for people who transition from one gender to another and or people who defy social expectations of how they should look, act, identify based on their sex assigned at birth. They can include a range of people, including trans masculine, trans feminine individuals who are more generally anyone whose gender identity or gender expression differs from their conventional expectations of masculinity or femininity. Other terms may be used as trans masculine or trans feminine. And this is deemed a transgender umbrella. It incorporates other terms that have been used in the past to describe transgender individuals. And it also depends on how someone chooses to identify and what terms they choose to use to when they describe who they are. So overall, understanding gender diversity. Not everyone in a category under that umbrella may identify with being transgender. So other terms like gender diverse, gender variant, gender creative, gender non-conforming, non-binary, etc., may be a term that individuals choose to identify with as that is more aligning what they deem as who they identify with. So there can be some distress for making distinctions about gender diversity versus who a person identifies with. Other aspects of components of gender identity are things such as gender expression, which is how we outwardly communicate about our gender, gender roles, which means how society expects people to, based on their presumed gender, including their responsibilities, actions, and attitudes, their sex assigned or presumed at birth, which is based on the outward appearance of our bodies at birth, and gender identity, how we feel about our gender. So overall, defining sex assigned at birth is based off of biological indicators, genetics, and genitalia. For the most part, when a baby is born, gender is either assigned based on genitals as male or female. There also is another term defined meaning intersex that can happen in about 1 in 2,000 children, but in general, a sex assigned at birth is usually male or female based on their genetics or their genitalia. So what is gender identity? Gender exists overall on a spectrum. It is a basic convention of who a person believes they are in terms of their gender, regardless of what body parts they have. People may identify their gender as binary or non-binary. And then individuals may choose certain pronouns based off of their gender identity versus she, her, they, them, he, him. Understanding the use of a person's personal pronouns rather than making assumptions is important when you refer to different individuals. And it's always a good thing to ask someone how they identify before making any assumptions based off of their outward appearance. So what is gender expression? Gender expression is how one presents in the world in terms of taking on culturally defined traditional masculine or feminine roles. How much more to do with their gender stereotypes, and it's historically and culturally relevant. So what is deemed versus masculine versus feminine? It has a lot to do with society influences on what a masculine and feminine person looks like based off of their outward appearance or what roles they choose to do within the society. And then as far as gender binary versus the gender continuum spectrum, it's important to note that gender is a spectrum and there is not one end versus the other. It kind of all can blend together. And this is just a list of identities and generational differences as far as terminology individuals choose to use, whether there's gender queer, gender fluid, gender blender. These are kind of different terms that over time people have adopted to try to fit closer to what their gender identity is in order to express what their gender is. And then when identity meets expression, we compare male, female, masculine, and feminine. Depending on that expression, what happens when someone's identity doesn't line up with what their expression is. And then we also think of sexual orientation, which is a person's sexual and emotional attraction to another person. And to clarify, an individual can be attracted to another person's gender identity or their gender expression. Sometimes people's attractions may or may not include attractions to primary and secondary sex characteristics. And a reminder, being transgender or gender diverse is not someone's sexual orientation, nor does it dictate. And as a part of the LGBTQIA+ community is help to encompass diverse sexualities and gender as far as terminology. As we learn more about gender and sexual expression, the LGBTQIA+ meaning and acronym continues to change and evolve to continue to become more inclusive of all gender orientations, gender identities, and gender expressions. People often do confuse sexual orientation with gender identity because of stereotypes about gender nonconformity, especially within society. But overall, what is gender affirming care? So gender affirming care is patient-centered and treats individuals holistically to align with their outward physical traits with their gender identity. And there's a range of services, including mental health care, medical care, and social services. Gender averse and adolescents in particular face significant health disparities compared to cisgender peers. So it's important as providers for us to be able to understand what goes on into gender affirming care and provide individual-based treatment plans to be able to help patients align with their gender affirming care goals overall.
Okay, great. Thanks, Dr. Singleton, for the overview. I'm going to talk a little bit more, just piggybacking off of her beginnings of the gender affirming care and kind of moving it forward across kind of what that looks like. So at the core of gender affirming care for an individual is transitioning from the gender assigned at birth to the individual's gender identity. So what does this mean? What does this look like? The takeaway is that it is incredibly individualized. So what transitioning is like for one individual may be very similar or different to another individual. And so this is something that we keep in mind for the care that is provided at our clinic. And perhaps those of you who are tuning in have seen these differences too in different individuals. So where one's individual's phenotype, by phenotype I mean the observed outward physical appearance, can be a spectrum from one individual to another. It's kind of like what Dr. Singleton was saying. So as we go through these aspects of medical care, just keep in mind that the transitioning is individualized and in many circumstances is based on the level of dysphoria or discomfort that is experienced by that individual, and other factors that we'll touch on. So one of those factors is unfortunately driven by certain narratives by other people. This can be people either close to the individual or apart from the individual. And a patient may have in mind not just what it means to be trans, but also what transition should look like. And not just patients, but also providers, practitioners may be impacted by a preconceived narrative as well. And perhaps too often, patients have noticed that in us as practitioners and are then forced to hoop jump to an office and then to another office until they can find that provider that can provide that gender affirming care with practitioners who focus not on a narrative, but instead on the individual. Another thing we as providers try to keep in mind is this concept of intersectionality, which is a mix of multiple variables that can shape experiences of an individual who is seeking gender affirming care. And these variables, some of them are seen in this bubble diagram here, can include race, ethnicity, family of origin, region where they live, generational differences, to name a few. So why is this important? I'd say it's important to remind us that there is no universal experience. There is no universal transition experience for an individual receiving gender affirming care. And I just want to make note of this slide as well when it comes to the age of an individual, as well as the age of the individual's support system. And so recognizing that there may be differences across the age spectrum that are listed in these bullet points below. And it's also important to note we can't extrapolate these because these are generalizations. We can't extrapolate them to each patient, but they can serve as a reminder of the differences of day-to-day living and relationships and interactions. And it can help us keep in mind how these factors may influence the care that is both desired and the care that we can provide as well. So Dr. Singleton touched on what gender affirming care is. And just to piggyback off of her, I'd like to include this slide and a definition that is provided by the World Health Organization, who states that gender affirming care encompasses a range, and this range includes social, psychological, behavioral, and medical interventions. And these are all designed to support and affirm an individual's gender identity when it conflicts with the gender that they were assigned at birth. So the interventions help those with gender dysphoria align various aspects of their lives: emotional, interpersonal, the phenotype with their gender identity. And not only can the gender identity run anywhere along a continuum, as Dr. Singleton mentioned, includes male, female, combination of those, neither of those, and sort of that fluidity. But these interventions as well can fall along a continuum, from counseling to changes in social expression to medications such as hormone therapy. And this bubble diagram shows what an individual may receive as part of gender affirming care. Now, this diagram doesn't include the social aspect of transitioning, which I do want to briefly touch on. So social transitioning may include things like changing name, changing pronouns, coming out to family, friends, classmates, coworkers, which may look different for each individual. It may include living partially or fully in the experienced gender. It may include changing legal documents, gender markers. On the other hand, or concurrently, medical transitioning can include the things here in this diagram: masculinizing or feminizing hormone therapy, gender affirming surgeries, other miscellaneous cosmetic procedures. It's important to keep in mind that not all transgender and gender diverse patients choose medical interventions or social transition changes. And there is often significant variability in people's decision making regarding both the social and medical transition, and to their respective degrees across the continuum. And these bullet points here also go along with the intersectionality concept mentioned a few moments ago. Okay, so let's get into some of the medical therapy, especially we as physicians can provide. That starts with gender affirming hormone therapy. So assessing readiness is an important part of this. And to help with this is a professional association called WPATH. And I just want to mention WPATH briefly. WPATH stands for the World Professional Association for Transgender Health. And it's an international multidisciplinary professional organization. Their mission is to promote evidence-based care, education, research, public policy, and respect in transgender health. One of the main functions of WPATH is to promote the highest standards of healthcare for transgender and gender diverse people through their standards of care. And their standard of care have criteria that are typical for providing hormone-related therapies. And so some of those would be a finding that an individual has experienced several symptoms of gender dysphoria that are listed in the DSM. A side note: the DSM is the Diagnostic and Statistics Manual. It's used by mental health professionals. That includes lots of mental health disorders, mental health diagnoses, and lists criteria for those diagnoses. If depending on the state and certain laws, if patients are under 18, parental consent is often required. Another could be a letter of support from the licensed therapist, with a written concurrence from a mental health professional for the provider as well. Ongoing psychotherapy is usually also included in the standards of care. Following this, and prior to starting somebody on hormone therapy, are going over the potential risks, benefits, complicating factors, all of which we have in a document and are reviewed in an office visit and signed by the patient, typically at a subsequent visit to allow time for further discussion, questions, etc. And so without going through that entire document, which is kind of outside the scope of this presentation, I just want to point out that some changes may be permanent, some may not be once hormone therapy is started. So spending time with this is helpful so that we can provide some expectations for an individual. And the hormones used, I'll mention here, are testosterone, which is, of course, the main male sex hormone, and estrogen, which is the main female sex hormone and produces feminizing features. These hormones are typically given on a daily basis or weekly or every other week basis. Just depends on what and how it is being administered. So going over what to expect once started helps an individual seeking this care to prepare for the changes that will occur. Now, still prior to starting and while taking hormone therapy as well, it is recommended to continue seeing psychology as part of gender affirming care, at the very least until mental health issues are reasonably well controlled. Now, because receiving different hormones that a body is not used to making can affect psychological aspects of an individual's well-being, is the main reason. It can get a little complicated, especially if the degree of dysphoria that a patient is experiencing is so high that beginning hormone therapy will be important in helping these individuals struggling with their mental health. So that's why I just want to reiterate that gender affirming care is really multidisciplinary and not just limited to taking hormones. Some things, important things that we make note to patients once started on hormone therapy. As with any medication, results don't occur if not taken or administered consistently. So this may seem obvious, but it's hard to remember taking something consistently without some sort of reminder until it almost becomes habitual. I mean, think about certain blood pressure medicines or antibiotics. There is an antibiotic called Keflex that is dosed 4 times a day for a urinary tract infection, and that's really hard to remember for anybody to do. Take 4 times a day. Adjustment of the hormone dose is also important and likely to occur once started. The providers at our clinic tell patients that frequent blood testing will happen. So we kind of lay that expectation out. And these would include things like testosterone levels, estrogen levels, metabolic panels, other tests, depending on the circumstance. And these will happen multiple times, especially in the first year, as the dosing correlates with the proper hormone levels and safe hormone levels. And also just frequent check-ins with the individual to come into the office to see what the response is like. Last couple of slides here, and the details of the actual gender affirming surgeries are kind of outside the scope of this talk, but it is important to point out that many patients with gender dysphoria seek affirming surgeries. And listed here are some of the examples: bottom surgery, top surgery, as well as cosmetic surgeries, including different types of facial reconstruction. I will note some, and I'll go on to say many patients never even have a surgery for various reasons. And as primary care doctors, we can, at a superficial level, talk about surgeries with patients. What I found with the handful of patients that I've seen in our clinic that have undergone a gender affirming surgery, or multiple in some cases, is that they had done a lot of seeking out on their own and in turn have shared their experiences undergoing that surgery, as well as the post-procedural stages, which have in turn helped other patients in the clinic just with some of the information that they've shared. But these bullet points are just some general things that we keep in mind when discussing these. So this is the last slide, and just a final note before ending on this slide. Dr. Singleton and I, we are primary care physicians, and in caring for a transgender or gender diverse individual, it's important that we reiterate to remember that other primary care management, such as health screening tests, are important. And as an example, health screening tests based on organs that an individual currently has. So just as an example, at age 21, we recommend beginning screening for cervical cancer. And part of this includes a pelvic exam. And you might imagine that a pelvic exam might induce a lot of dysphoria for discomfort for someone who is trans male. The goal at our clinic is to approach this with sensitivity, awareness, and to work with that individual to make the process as least dysphoric as possible. And of course, talking about alternatives to the procedure, exams, those things are also discussed. I do want to say that this type of environment extends with our staff as well to make our entire office the same or as similar as possible for patients. So it goes from as simple as if a patient was assigned male sex at birth and identifies as female, treat her as a female, and our staff does this. The clinic tries to create a transgender friendly clinical environment. There is usually good open communication with the promise of confidentiality. And I will say slip-ups happen. We acknowledge it. It's important to acknowledge it, apologize, and move on, but also not to make a big deal about it or ignore it, right? Acknowledge it and kind of learn from it. I think that the biggest takeaway and thing that I want to reiterate is one of the fundamental thing that I've noticed in seeing transgender patients or gender diverse patients is that what I found is what they seek from health providers is someone who's culturally and medically competent to care for them in an environment where they feel safe. And I feel like our clinic can provide that. So with that said, there is a couple of questions here that I just noticed in the chat box that I'll read aloud. So the first one is gender affirming care part medical education, or is care a specialized service after general training? So it can be a combination. In the primary care fields, I don't want to speak too much about specialty fields, but in the primary care fields, most residency programs training now include some aspect of gender affirming care. So, especially over the last 3 years, 5 years, more and more programs are adopting it. And of course, if a physician wants further training once out of medical education, that person can seek that too. And then most gender affirming care is covered by insurance. It again depends on the type of gender affirming care. Hormone therapies in particular generally are, but the patient may not be able to choose the exact method. For instance, if insurance may dictate whether something can be taken orally or something has to be applied topically. So there's a little difference in that. There's a lot, and then I'll read this final question. There's a lot of concern around reproductive services and providers dealing with opposition in their practices. As a gender affirming provider, are there similar concerns with offering care to sexual minorities? How I'll answer that is that, yeah, there's going to be different offices, different providers in the area and in the United States that do have providers with differing opinions on this. What I will say when it comes to minorities is that there are certain confidentiality things that by law are just to be kept between the patient and the physician. When it comes to providing things like hormone therapy, that's not the case. And in our state, I believe, I think it was House Bill 808 back last fall, put some restrictions on starting any adolescents on hormone therapy. So yeah, there's some navigation things there that both patients, and it mentioned about kind of jumping hoops to different clinics, as well as practitioners run into, depending on what the opposition may be. So, I don't know, Dr. Singleton, do you have anything to add or?
No, I agree. It is provider specific on if they will provide care to sexual minorities. So it can be tricky to navigate about finding a provider who will be able to offer those services. Because it is not something that every provider is going to be trained in, and some providers may not feel comfortable with offering that service. So it can be something that can be difficult to navigate that field. And it's important to be able to know of resources in order to find those providers who can provide that service that individuals are looking for.
Yeah, and I will say the ethical side of this that if a provider is maybe not willing to provide a certain type of care that an individual is seeking, the provider is supposed to ethically refer the patient to a different provider that can. But those are all great questions. Hopefully that answered some of them for you. And I'm unable to see exactly how many people are tuning in, but if there's any other questions, feel free to type them into the chat box.
I have one more for you guys. Is there a database for gender affirming care services clients can research?
A database. A lot of the gender affirming care information that we use is with the WPATH website that is accessible via internet, and it is something that really guides gender affirming care for primary care providers or other providers to really know on the guidelines for when we see patients in clinic, as far as what type of treatment plans we're going to be using, what type of routine lab work, what kind of other testing that may be required, and other expectations. So the WPATH website is something that pretty much guides the expectations of gender affirming care and kind of provides the best guidelines, kind of what things can expect, patients can expect.
Great, thank you. And then I had one personal question of my own, if that's okay.
Yes.
Yeah.
Is gender affirming care just for transitioning or gender fluid people? Do cis men and women also partake in gender affirming care?
I don't know if I've ever had that question before. The patients that have come to this clinic that we've helped with gender affirming care have been gender diverse. I don't think that I have at least had any cisgender people who I identify as that seek out if that person is a male, that they would seek out feminizing therapy or vice versa. I suppose that, yeah, that's certainly possible, especially since it is a continuum and someone might seek some of that hormone therapy. And again, it's a little bit of discretion about how much of that continuum and how much dysphoria that patient is experiencing to help sort of guide that decision-making process between the patient and the physician.
Okay, because I had a personal conversation with a friend of mine that is a cisgender female, but she wanted to get some stuff to make her feel more feminine. So would that be considered like breast augmentation or nose rhinoplasty or any of that stuff? Would that be, even if you are a cis person, would that still be considered gender affirming care?
Oh, I see.
Mm-hmm.
I see. So if the patient is a female and decides to do breast augmentation for more feminizing patients, yeah. So I think from the definition provided by the World Health Organization, no, but in a way that would be providing a gender affirming therapy to that patient. So I would say that's fair to say, yeah.
Okay, great.
Now, I don't think in that case, going off of Ms. Spratley's question, that insurance would cover that.
I just want to thank Jack and Andrea for joining us today and giving us some great information. I hope it was all helpful to everybody watching. And thank you guys for all attending. Hope everybody got some insightful information today.
Thank you for having us.
Thank you.
Of course, of course. Thank you guys again. Yes, and have a great day, guys.